These footages definitely divulges us to India's heart-wrenching COVID-19 tragedy. From the first wave, a period of ephemeral calm, to now what experts are calling a deadly second wave. India is spiraling again deeper into COVID-19 pandemic crisis. This deleterious COVID-19 second wave has devastated big cities like Delhi, Mumbai, Lucknow, and Pune. There are new cases surging up past 400,000 per day and breaking the record for the highest single-day figure globally. Hospitals have run out of space and basic medical supplies, with innumerable patients dying due to oxygen shortages. Funerals are taking place in car parks.
Perhaps now you are asking, how did India get to this point?
Several factors came together to create this unprecedented explosion. The government has been criticized for its sluggish vaccine rollout, as variants believed to be more transmissible spread throughout the country. Furthermore, many people in India had also started to grow complacent. Residents relaxed COVID-safe protocols like social distancing and wearing a face mask. This complacency was not only fueled by pandemic fatigue. Political and religious leaders publicly downplaying the severity of the pandemic and calling for mass gatherings also played a role. Despite the coronavirus surge, the government allowed hundreds of thousands of Hindu devotees to participate in Kumbh Mela, the country's biggest religious event. It also continued holding political rallies during state elections, with the ruling BJP party holding especially big gatherings. At one such event in West Bengal state, Prime Minister Narendra Modi thanked the crowd, saying he had never before seen such huge crowds in a rally. Undeniably, the complacency has backfired.
Now, how is the world responding?
The international community is rallying to aid India in its fight against the pandemic, with countries from all over the world pledging assistance, such as oxygen and related supplies, ventilators, PPEs, rapid diagnostic test kits, therapeutics, and ICU equipment. Meanwhile, on the ground, community centers and humanitarian organizations are working to provide masks, curb misinformation, and are dealing with a great amount of vaccine hesitancy to wear masks and to social distance. All of these assistance are important. However, given India's population of nearly 1.4 billion people, more will be needed, and even these will not be sufficient.
India cannot do this alone. We need the global society to transcend, all for one. The global society should revamp our multilateral systems such as United Nations and World Health Organization, like establishing a global health security coordinator in every nation and work with each member states to create a health security coordination committee to facilitate a prompt and coherent multilateral response to global health threats.
Each country in this global society should also support multilateral mechanisms to manufacture, allocate, and deliver COVID-19 vaccines, therapeutics, diagnostics, essential health technologies, and products in a globally fair manner consistent with public health needs. Because with the absence of global coordination, countries could bid against one another, driving to skyrocket the price of vaccines, therapeutics, diagnostics, and related materials. The result could be not only an unnecessary loss of life and economic costs for already suffering economies, but also a legacy of resentment against vaccine hoarding nations. That resentment would undermine the global cooperation required to tackle future outbreaks and have ongoing adverse economic, diplomatic, and strategic consequences for the global society.
This global society must take the lead to build a modern national and global epidemic surveillance and forecasting capacity. Each country should work with other governments and civil society partners to build and integrate national and global epidemic surveillance systems which would detect, share, and publicize early signs of an outbreak in real time. This framework should establish a voluntary international sentinel surveillance network founded on healthcare facilities around the world that regularly share hospitalization data using anonymized patient information to identify unusual trends. This global surveillance architecture should be linked to public health agencies and participating nations so that the data can be used to directly inform preparedness and response activities to both global and domestic threats.
In the ground, we, as the people in this global society, must work hand in hand in order to help each other, no matter how small or big it is, because it's clear as broad daylight that no one will be safe until everyone is safe. We can keep the people safe and informed about the coronavirus through social media platforms. Not just that, we can be the instrument to make it easier for the people in need to find help and bridge them to ones that are willing and able to offer help in the communities. We suggest that these leading social platforms such as Facebook, Messenger, Instagram, and WhatsApp must also be awakened of the current situation that the world is facing. We recommend that they should use their platform and resources and work closely with the multilateral systems of this global village and to what we have suggested, Health Security Coordination Committee in every country in order for the people to access accurate information, support relief efforts, and keeping people connected.
As we watch the coronavirus pandemic play out on a global scale, it is easy to feel helpless. But no matter who you are or what your situation, you can make a difference. The easiest way to give back is by reaching out to the people you know. Neighbors, friends, co-workers, and relatives can all benefit from a friendly text or video call. It may seem like a small gesture, but don't underestimate the positive impact of checking up on someone. If you're strapped for cash, there are ways to donate without spending money, like donating non-perishable food supplies, supporting your community food pantry. If you have more than you need, you can also donate personal protective equipment like surgical masks, things like toilet paper, paper towels, hand sanitizer, bleach, rubbing alcohol, and disinfecting wipes. You can also use your skills. Get creative with ways you can help out. Chances are you have a talent that can be of service right now, like sewing, as hospitals are facing a shortage of personal protective equipment. If you are a financial planner, you can lend your skills to help those who lost their jobs due to the pandemic. If you are a fitness coach, offering virtual classes are a great way to lift people's spirit and get them moving. And if you are a teacher, you can induce to your lesson opportunities like igniting the passion to rekindle student motivation, not just for the class, but also to help raise awareness with this current situation that the global society is facing now.
The COVID-19 pandemic is still not over. It continues its deadly march, and the specter of new waves of the disease will haunt us until no one knows when. The only thing that is certain is that when this virus is over, another one will take its place. However, pandemics may be inevitable, but the systemic policy that accompanied the spread of the coronavirus were not.
The recommendations we have propounded earlier are designed for global pandemic response, prevention, and preparedness. These recommendations will only succeed with the help of the leadership from different policymakers working in concert with each other in foreign governments and multilateral institutions. Without such leadership and partnerships, accompanied by institutional reforms and adequate funding, the future pandemic response, prevention, and preparedness will be no better than the current modeled performance with high human and economic costs.
This is true above all, that we are stronger.
We are stronger.
We are stronger.
We are stronger
When
we are
are
together.
together.